Hi, I'm Dr. Caroline Leaf, and you're listening to Cleaning Up the Mental Mess, a podcast all about giving you simple and sustainable strategies to help you live your happiest, healthiest, and most peaceful life. In today's podcast, I talk to an amazing guest, Dr. Paul Conti, Stanford and Harvard-trained psychiatrist, who has an excellent insight into trauma and the need for a biopsychosocial spiritual approach to understanding the root of trauma and how to manage it. He says, trauma fogs the mirror and distorts the window. We then can't see ourselves as we are, and we can't view the differences of others as anything other than harmful. We dive into this as well as how can we manage this and change this. Before we begin, if you want to listen to my podcasts ad-free and have bonus content and live Q&As, then subscribe to my Patreon account. The link and the details will be in the show notes for that. And as always, as I say, this podcast is for educational purposes and is not medical advice. And if you need medical advice, please contact the appropriate medical professional. And now, on to today's podcast. Dr. Paul Conti, I am honored and I am so excited to interview you. It's an absolute pleasure. You're phenomenal. Your book is fantastic. I read this thinking, oh my gosh, I feel so happy and so validated in my approach. So thank you for agreeing to come on this podcast today.
You're welcome. Thank you so much for having me. It's an honor to be here and I so appreciate it.
My pleasure. Thank you. Now, you are an absolute expert when it comes to trauma. And this is a conversation before we began, you and I were just having a little chat. And I've been a little concerned, not concerned, but kind of watching what's going on in the media at the moment. And there's a swinging between we overuse the word trauma, we underuse the word trauma, we're not validating PTSD correctly. And it's kind of got to the point of, what is trauma? How should we use the word? And should we be saying it? Shouldn't we be saying it? And I know you and I both come from the angle of we should be trauma-informed, and there's different types of trauma, and we need to understand the different types and the different impact. So I'd love to begin with you just, maybe diving in on this conversation, and then we'll get into depth in your brilliant book.
Thank you. Thank you. Thank you so much. I think that it is a problem when a word is used so much, right? It can almost lose its meaning, right? Because there's not a sort of context to it. And I think the idea that trauma, we define it as if trauma is, if anything that overwhelms our coping skills, right? Overwhelms the systems inside of us that help us keep ourselves oriented and keep a sense of self, right? If those systems in us are overwhelmed, then something has happened in us that is truly traumatic. And we see that because on the other side of real trauma, there are brain changes. So it's not just a sort of soft assertion or anything negative, that happens to a person becomes trauma, because of course we know that negative things in our lives, setbacks, difficulties can build perseverance and strength and character, right? So it's not just that anything negative is trauma, right? But true trauma overwhelms the coping systems in us, and it leaves us different as we move forward. And we see that through the lens of brain science. So it's not a soft assertion, or it's not it's not a word that can have a shifting definition. If we define it through the lens of brain science, then we can understand it, and we can also then be able to assess for it and be able to decide about treating for it, and ultimately, ideally, preventing it.
I love that answer. And the field that I've been in has been looking at mind brain body research for all these years and showing, back in the 80s, I remember one of my professors telling us the brain can't change, and your patients with trauma or TBI, that's it, you've got to teach them to compensate. And I immediately said, that can't be right. And I did some of the first neuroplasticity research in my field. And then mid-90s, we got technology. And now we know, Dr. Conti, that the brain can change. And as you say, the impact of life on every aspect of our life on our brain and body is something that's undeniable and plays out in our behaviors. And you really have written an incredibly brilliant and easy book to read. It's full, but it's easy to read. I'd love you to just tell us a little bit about the book and what made you write it. And you've even got Lady Gaga as did the forward, because you treated her at one point. So maybe you could start there and just dive in a little and tell us about why you wrote the book.
Sure. I never set out to be a trauma person, right? Or to have that be my route of approach. But in 20 years of doing the work that I do, I just saw over and over and over that trauma and the changes in us, in our brains, and the changes in us psychologically, how we see ourselves, how we orient to the world, has flowed through so much of what I'm trying to help. Right. So it wouldn't matter, someone presenting with depression or anxiety or addiction or feeling overwhelmed by life or whatever it may be, that when you sort of look at what's going on, right? What are the root cause of what is ailing that person, or, in so many of us, including myself, that the root was the same, that if you sit and talk with people about what is going on in them and what is at times making them not just miserable, right, but at times threatening their life, right, and you trace those roots back, the roots trace back to trauma. And I think the world around us doesn't acknowledge this. I use this analogy a lot, that we live in a world of healthcare that wants to polish the hood when there's something going on in the engine, right? And we look for these quick fixes, and we just look for throwing medicines at things. I mean, there's got to be a reason why we, for example, use 5 times more medicines than, say, the Dutch population, or populations where there's not just a reflex to throw medicines at things. And we've sort of lost this idea of trying to understand people, right? And trying to understand what's going on inside of us and how does it affect us. And it was seeing that over and over and over, and also seeing that if we tried to get to the root of the problem and we identified trauma, and again, not in everyone, but in the majority of people that I have tried to help over years, right? We identify trauma, and if we go to that trauma and we really explore it, and we explore how it changed the person, which often we're not aware of, right? Unless we look at it and explore it, that we get better. Right. So it's not, it's not sort of philosophical. It's not esoteric. Right. It's a very simple truth of how to understand and help people. And it applies to people across the board. Right. Which is how I think that I've been able to say help a lot of the people I've helped, and how I've been helped, through my own psychotherapy, right. Through being a patient and being helped. And I think it's how I was able to help Stephanie, that Stephanie Germanato, who is Lady Gaga, that she has been very public, that she has trauma in her life, but the changes in her, and sort of being able to understand that, and to ground to a true self, and to look at the narratives that come of trauma, and how we can again take control of the narratives in our lives. It's helped people across the board in all socioeconomic demographics, and yes, it applies to Stephanie, who I'm so grateful has written the foreword for my book. It applies to her, it applies to me, it applies to so many people that I've been able to help over the years, or seen helped by good clinicians over the years, or just seen helped by trying to get a handle on themselves and their narratives. And it was that drove me to write the book. I mean, it's a lot of, as you know, right, it's a lot of time and effort, and there's a lot that goes into it. And I think, for me at least, there's got to be a passion inside about it in order to be able to bring that effort to bear. And that effort really came through the lens of seeing this is so important and just so under-recognized.
We all know that what we eat can impact our mind and brain health, which is why my family always tries to look for new, tasty and interesting foods that taste great and are nutrient dense. This is why I love Imi, the world's first low-carb, high-protein and 100% plant-based instant ramen. Each serving of Imi has 21 grams of protein, 19 grams of fiber and only 6 grams of net carbs. It's also non-GMO and is 35% lower in sodium versus traditional brands, which leaves you full and satisfied without the post-ramen bloating and thirst. It is also really convenient if you have a busy schedule like myself. Imi is super easy to prepare in the microwave or stovetop, and you can have a bowl ready in just 7 minutes. My personal favorite Imi is Tom Yum's shrimp-flavored plant-based ramen, which has been keeping me warm and satisfied this winter. Imi is also proud to offer a 100% happiness guarantee, so you can try Imi risk-free and decide for yourself if Imi is worth it. If you're not happy with your Imi, they will offer you a full refund within 30 days of purchase. Visit imieats.com/Dr. Leaf to try Imi's delicious low-carb, plant-based and fiber-rich ramen. That's imieats.com/Dr. Leaf. The link and details will be in the show notes. Oh goodness, I'm so glad you said what you said. And that's, it's so true how you speak about getting to the root of the issue. And you describe so beautifully now, and also in your book, about how the current system is all about, identify the symptom and treat the issue. And we've lumped the whole experience of life into the medical model. And yes, we have to deal with the impact on the brain and the body. There's, thank goodness for medicine for that. But that's not dealing with, that's the polishing of the hood. We have to deal with that, but we have to look at the story that brought us into that situation in the first place. And you comment on the healthcare systems failed us in that way. You commented on the fact that you can't just throw medicine and 10 sessions of CBT where you're just trying to take that thought and not deal with where it comes from, but just replace it. You can't just put a Band-Aid. You have to actually deconstruct and reconstruct and find the source of that problem. Yes. So, and that's vital. It's a vital component. So and I know your story, and because I've heard it, but I'd love my audience to hear your own story of how you were in another field and you had a fairly okay upbringing, and then you had a major traumatic event, and then you changed profession. From what I understand, you went in another direction and landed up doing what you're doing. Could you tell us your story and how you got here?
Yes. Thank you. That is in my own life. I came to understand in retrospect, right, how much trauma had impacted me. And I understood that in part because I didn't have major trauma in the first part of my life, right until my mid-20s or so. And I had a business career at the time, and the career was going well. And there were a lot of things that I liked about it, but I also wasn't happy, right? And I had a whole set of thoughts about changing my life and going in a different direction. And also felt like I couldn't do that, right? Like I felt like I was too old to make the change, and like all these things that I felt while in my mid-20s, right? It was a huge trauma that really ground everything to a halt for me when I lost my brother, my youngest brother, who had chosen to end his life by suicide, which was a terrible and tremendous shock. Thank you to me and to my family. And what happened after that is I just had this whole different set of thoughts and ideas, that instead of thinking that that I was a person who could maybe make an impact on the world, who could apply himself and have good things come back in return, right? Who for whom the world was a place that would let me navigate, right? And let me make my way forward. I started to have a whole set of different thoughts. And, they were thoughts of feeling ashamed, right? That like, I didn't know this, that it was my fault that it happened. And, I should have seen, I should have known, I should have done something different. And thoughts that like, oh, we're all cursed, and I'm cursed, and my family is cursed. And my mood changed, and my sleep changed, and my self-care changed. And, was fortunate to have really good people around me. And I just sought some psychotherapy, which is not something I'd ever done before, or, even something I felt comfortable doing. Right. But I sort of went and did it in part out of desperation. And it really brought to light how much had changed in me because of the trauma that happened. And it reminded me that, like, you've forgotten this, it's who you were. And my life was going down a path that wasn't so healthy. I was drinking more than I should. And I was kind of doubling down on the unhappiness, and it was through that I realized that, I can do something different, or I don't want to I can't lose myself in this. Right. And it really emboldened me to then go and do things that I didn't feel that I maybe could do, right? So in a sense, there was something sort of traumatic about being in a situation that wasn't the right one for me, but not feeling empowered to change it. But it hadn't risen to the level of the shock of the loss of my brother. And it was the shock and all the changes in me, including the ones I didn't recognize until I went and got some help, that let me realize, oh my goodness, like I have to find again myself and my grounding and my footing and make decisions in a way that I choose to. And it was that empowerment that led me to say, look, I can do what I choose to do, right? Even if I'm taking some chances in doing it, and to leave a good job and leave a good career path. And I ended up going back to college for a year because I didn't have any pre-med classes, and then starting on this different path that led to medicine. But it was the shock of the trauma and the shock of realizing the changes in me that led me to do that. And then, of course, as I then became a psychiatrist and saw, like, okay, this is what's happening in so many people who after trauma then lose their anchoring to who they are, right? And then start to have a different life narrative without realizing that their sense of self and that their life narrative and their sense of possibilities has changed.
Wow. Wow. That is so well said. Well, wow. What is an incredible story, and how you turned that. I love the part where you actually say how you recognized the changes, you became aware of them. And as hard as it was, you sought the help. And that helped you to see the root cause, and you basically reconstructed your life. So the story is still there. It's still painful to talk about your brother, but you haven't got lost in the pain. You've actually taken that pain and you've moved forward and transferred that pain over to now understanding what you were going through, how you were helped, then studied that, and now you're using that to help others and touch other people's lives, which is an incredibly beautiful story of humanity, of what we should be doing, of how we should be transforming and changing, and how it's hard as it can be, with help, we can do these things. We can, edit what life has thrown at us and move forward, which is incredibly beautiful. Well, I want to quickly talk about something, and then I'd love to go into the depth of, I think, what's going to help people a lot, because this is how what really got me. I was really, really validated when I saw this in your book about the different types of trauma, because that's kind of how I explain it too. And I love, love, love how you explain it. But before we do that, I read an article this morning and I sent it over to you just before we started. And it made me so excited that I'm just going to read out, and I'd love your just to comment on this. The WHO and United Nations join calls to transcend the medical model. And basically what they're saying is the United Nations Special Rapporteur called for a move away from drug companies supported biological explanations of human distress in 2019. And then they recently echoed the United Nations the World Health Organization recently echoed this in another report calling for a fundamental change in mental health services. So going beyond just polishing the hood, as you said. And the report emphasized, and I was so thrilled about this, social determinants of mental health such as violence, discrimination, poverty, exclusion, isolation, and unemployment. In other words, we have to consider the person's whole story and their context, and not just throw the medications and the 10 CBT sessions and individualize the issue. And although you experience that as an individual, you experience the environment as an individual, and you've got to help the individual with the medical impact that it's had and to go to the root cause. At the same time, we have to not let them feel the shame of thinking they are broken brain. They've got a neuropsychiatric brain disease. There's something wrong with them. It's an impact of what they have gone through. So to see this on a global scale now as being a shift is such an exciting thing, because as we both know how things started, this shift towards a very neurocentric approach has been going on for the last 40 odd years. So maybe we're now starting to shift back to the story model. So I love your comments.
Oh, I find that to be so validating and so hopeful. I mean, we don't get a lot of hopeful news, these days. And this is, I think, is a piece of hopeful news, because I think the medical model has really become, I think, certainly in the United States, and I think in many other places, it's really become just the medication model. Right. And like that is such a dumbing down of what's actually going on in people. I mean, if you think of what is the gold standard approach of a biopsychosocial spiritual approach, right? The bio part acknowledging that, okay, even think of the validation of the biological part that, that trauma that overwhelms our coping mechanisms leaves us changed as we go forward. And we can determine and validate that by scientific measures, right? The cutting edge of neuroimaging shows us this. The cutting edge of, say, epigenetics shows us this, right? And the idea that I interviewed Darren Richarder, who's a trauma expert and a professor at Stanford in the book, and Darren talks about how there was at one point a thought that rape as a tool of war it's a one-time event, like a bad thing happened at a certain time, right? As opposed to what we now understand is that changes people, right? And it changes generations, that now the genes and whether the genes are active or not, that a person transmits, it could be years later, are impacted by that event. I mean, what greater validation can we have of trauma, right? And the impact of trauma on us biologically. So we can use the biological aspects to validate the truth of all of this and to understand routes of approach, which sometimes involve medication, for example, right? There's just one aspect of it, right? But if we see it that way and allow it to help us, right?
In an acute, sorry to interrupt you, but in an acute situation, so the person can just get through the immediate moment. But in the chronic way it's been used, it's a bit questionable because it's like the solution. So I just wanted people to understand. I don't know if in terms of the acuteness of the situation, medication can certainly take the edge off, but it's not the solution.
Right. There's a role for all of it. Right. But if we're just throwing medicine, then we're making no use of biological understanding. Right. We're not using it. And then we're not then using it to transition to the psychological, the sociological, the spiritual. Right. Which is where that's how change really happens. Right. It comes through understanding, wait, what has happened to me? Right. How has it changed my conception of myself? How does it change my conception of the world? Can I understand myself differently, right? Have I as somewhere lost my grounding to what is true about me? I write in the book how there's a map that we sort of often will have about ourselves, right? Of like, I think I know who I am, I know where I want to go, and we'll see this in people at hopeful stages of life, right? And after trauma, we can forget that, right? We can forget what we knew was true about us, what we wanted for ourselves and for the future, right? And if we understand ourselves, and we can find and address trauma at its roots, right? The psychological impact upon us, how to take back control, the impact of us in societies, right? And how societies can facilitate or prevent trauma. And ultimately, there's a spiritual aspect of it too, that how we are in a sense the same boat together, right? And we have to pay attention to the world around us, whether it's climate change or it's how we handle violence, how we handle interpersonal distress, how we communicate with one another. That if we look at the richness of it, the biological, the psychological, the sociological, the spiritual, we know that that's the gold standard, but we've somehow dumbed it down to a medical model. That's not even a medical model, right? It's just take an inventory of symptoms, which is what the DSM is, right? It's an instrument of taxonomy, right? It takes an inventory, right? But if we say, okay, let's just take an inventory of symptoms. I think it maps to this, right? And if it maps to this, which has no life in it, it's just an inventory, right?
Exactly, it's not a description.
Right. It's one aspect of description. It doesn't tell you what something truly is or isn't, right?
No, nothing about the story or environment or context or circumstance or anything.
Right. So if all we're going to do is take an inventory of symptoms and map it to something that doesn't actually tell you what's going on, then of course we just end up at throwing medicines at something, right? Which is why people very often don't get better, right? I can't tell you how many people I've seen who've had, for example, 5 residential stays, right? For addiction, right? And no one has taken a trauma history. Right. So no one realizes, all of the problems, the depression, the anxiety, the terror, right, that led to the substance use and led the person to then relapse after the residential stay is rooted in something that happened to them. And after that something, everything changes in them. And that's when all the problems start. Right. But no one thinks to ask that. Right. And this is really the standard in the world around us.
Taxonomy of the DSM is actually blocking our ability to see a person's story because they've got so caught up in the symptomology and the treatment of the symptomology as opposed to, what's actually under the hood and what's going on, as you use that analogy. So, and you know, the DSM-5 is about to come out in March, and it's apparently got 500 and something. So it's expanded, the taxonomy is expanded now to over 540 odd, something like that, different so-called disorders.
Yeah, which is remarkable. I mean, you now have a gigantic book that, if you look through it, will give every one of us, a bunch of diagnoses, right, without any validity or any life to what that really means in a person's life. And it's time to look at that for what it is. It's an instrument that can help research, right? And it can say, okay, we can communicate by taking the inventories, and then it helps do research. It helps communicate. But the idea that somehow that is, what people will call it the Bible, right? To refer to it like a religious text, right? When all it is an instrument of taxonomy, so leads us astray. And it fits with this idea of just take an inventory of symptoms, and then that inventory goes, bing, okay, this is the medicine to use, or that's the medicine to use. And it's remarkable how misleading that is. It leads us away from understanding people. It leads us away from being helpful to people. And I think there's so many people out there who are trying to be and wish to be good clinicians, but are working in systems. And how do people work in systems where you have 15 minutes to try and see and understand a person? I mean, how close are we to just vending machine medicine of like tap in your systems and being in a medicine will pop out? And look, I mean, it's just so clear that our mental health as a population is declining. I mean, it's indisputable. You look at the opiate epidemic and how many lives have been lost, and the despair that we see around us, and the rising rates of suicide in across the population, and everything that we've suffered through the pandemic, isolation and violence behind closed doors. And we look at the helping systems around us, and they've so clearly failed us. And I think it's indisputable that this model and the way that we're handling, that we're trying to handle mental health is, it's so focused on throughput, right? And it's so focused on the superficial that we lose our ability, and there's often no help to be had. Right? That even people who have insurance, I mean, they can't find someone to sit down and actually help them. And ultimately, even if we just look through the lens of dollars and cents, which is like obviously not the right way to do it, but so many of our systems are doing exactly that, right? It doesn't help that we become like sort of penny wise and pound foolish, right? Where we don't invest in the human mechanisms of helping, right? And then we allow the furtherance of illness. So how many people who don't get the help that they need then are hospitalized, right? And they're hospitalized how many times? They can't take care of themselves, and then they have how many medical problems? We know that more than half of complaints people present to physical medicine physicians, right, are coming from mental health places, or coming from distress inside of them. I mean, what is the cost
and from
in terms of
withdrawal from psychotropics, or the side effects of psychotropics that have been unmanaged or not managed properly or whatever. So
sure, between heart disease and not being able to take care of one's diabetes. I mean, there's so many medical problems and medication related problems and addiction problems. And it's like we spend billions of dollars, right, on all of that. And if we just looked at what is what's actually going on here, we would spend far less resources and we would help people far more. But we're so busy in looking at what's the bottom line today and how much throughput can we have tomorrow, that we're missing the big picture, and people are dying because of this, and lots of people. I mean, that's not an exaggeration or catastrophizing. It's exactly what's happening. And if you're in the field, you see it over and over and over again. Oh, all the helping systems failed that person, and now they're dead. And that's it. That's the end of the story, right? There's no follow-up then of like, how do we understand that better? How do we change that? And it's tragic, and it's playing out in such a big way that we can intervene in and change. And that's really the message of the book, which is it's meant to be read by anyone who chooses to pick it up. It's meant to be engaging, and it's meant to describe ways in which we can help ourselves and others today. Right? Because the ways of understanding this and making things better are not rocket science, right? Even though the science can be cutting edge and all of that, the actual means of how do we make change in ourselves and in others? How do we stop today and do a better job of understanding ourselves, right? It's not that difficult or that complicated. And I mean for the book to paint a clear steps that we can all take today to make a difference.
Wow, that is so beautifully said. And so necessary, such an incredibly important message that I 100% resonate with. And there's two angles I quickly want to go down here, and three angles, so that we can get people some help. I want to talk about, it's not that difficult. I want to talk about what we can do, but I'm going to save that's the third part. The second part I want to talk about quickly defining the different types of trauma, but I want to begin with just emphasizing the fact that we have almost made the stigmatization worse with the medical model. As the United Nations report says, we've gone bio versus biopsychosocial spiritual.
Yes.
Even though we talk theoretically about biopsychosocial spiritual, we're doing bio. When I say we, not you and I, the system. In the attempts to put out all these public campaigns to try and decrease stigma and say you have an illness like diabetes, it's actually increased stigma. That's the one thing I wanted you to comment on. And the other thing in this first chunk of information is there's study that they began, a huge study in 96, and that ran through to 2014, 2015. I actually talk about that in my book, where federal data showed that the people are dying 8 to 25 years younger from lifestyle diseases, and a lot of it's pointing to how we're managing our lives. And that was pre-pandemic. So we already hit the pandemic with everything you've just described. Right. And the solutions we've been offering have not worked. The bio model has made it worse, basically. And we've got to go back to the whole lifestyle, the whole person, the context, everything we've been saying. So that was just to emphasize what you're saying, that there's actual research showing what you've just described so eloquently. There is so much research to back that up, and that we have to make the change. And we're going to talk about that in a moment. But then also would you like to comment on that before we dive into what the types of trauma are and what we can do?
The dangers of the bio model is, right, what it ends up doing is reducing people to numbers, right? The number being the diagnosis, and then describing how people have failed medicines, right? So to hear, I hear people describe, oh, that's a 300.02, 296.33 who's failed such and such medicines, right? And it's like, we're talking about human beings here, right? And we then lose our ability to help people. So it's no surprise that our health as a population has declined. I mean, with our increased interconnectedness in so many ways, it brings good things, but it also can bring negative things, right? And we have social problems, we have economic problems, we have so many problems that are pervading through the population, and we're doing a worse and worse job of helping ourselves as a population. So we see that was in a very, very bad place before the pandemic, which has driven all of that to be worse. So I think that part is very clear.
People don't always realize that physical symptoms like headaches, teeth grinding, and even digestive issues can be indicators of stress. And let's not forget about doom scrolling, sleeping too little, sleeping too much, undereating and overeating. Personally, when I'm stressed, especially when I have a lot on my plate and feel overwhelmed with work, I tend to get bad stomach aches and headaches, which can really impact the rest of my day and even my relationships. It's so easy to snap and get annoyed when you're in pain, especially if you don't communicate how you feel to your loved ones. Stress shows up in all kinds of ways, and in a world that's telling you to do more, sleep less, and grind all the time, here's your reminder to take care of yourself, do less, and maybe try some therapy. I find that talking to someone I trust is one of the best ways to manage toxic stress, and therapy is another great way to do this. BetterHelp is customized online therapy that offers video, phone, and even live chat sessions with your therapist. So you don't have to see anyone on camera if you don't want to. It's much more affordable than in-person therapy. Give it a try and see if online therapy can help lower your stress. This podcast is sponsored by BetterHelp, and Cleaning Up the Mental Mess listeners get 10% off their first month at betterhelp.com/code. That's BETTERHELP.com/code. Just very quickly on the stigma that's increased in the attempt to decrease, we've actually increased because now people are too scared to say that they've got it. On one hand, they're saying, I've got a brain illness, accept it like diabetes. But on the other hand, that's impacting, there's something wrong with you. So there's a lot of conflict inside a person and society about what's the right way to explain this and say things. And the research shows it's made the stigma worse.
Right. Because we don't normalize that. Look, we all have mental health issues. I mean, look, it's like sometimes we can have a mental health problem, right? Something that really is a problem and warrants clinical attention. Like after the loss of my brother, I had a mental health problem, right? That was a real problem that threatened my ability to navigate my life forward, right? So I'm fortunate at this moment that I don't have a salient problem, but I certainly have mental health issues, right? We all do, right? And if we look to this book that ultimately we want to use to pathologize all of us by giving all of us a bunch of numbers, right? Like it's not helpful. It's pathologizing. I mean, as opposed to saying, look, we all have issues that can warrant being addressed, and some of them may be smaller and some of them may be greater, right? And if there's something going on that's rising to the point where it's like changing how you're interfacing in the world, you feel different, right? Your mood is lower, your enjoyment is lower, your anxiety is higher, you're having panic attacks, you're having problems sleeping, right? Like, how about getting help for that, right? And if there was a system that said, I'm going to take stock of what's going on in you, right? Let's talk about what's going on in you and let's try and help you, right? Like that would be very, very different, right? Than the idea that, hey, there are very limited helping resources. And if you come to get help, right, you may see someone or likely to see someone who's so overwhelmed that they have little time to even make eye contact, right? As they're going to take an inventory of symptoms, tell you what your number is, right? That's your number, that's your diagnosis, right? And throw some medicine medicines at you. Oh, and then, and people often will think, that doesn't seem like that's going to work, right? And on the other side of it, so if you already kind of feel that, and then on the other side of it, right, which a lot of people go through, now you've failed this medicine, failed that medicine, and they want to throw another medicine at you. I mean, how disheartening is that?
No, it's
right?
terrible. It's disheartening. Do you want to talk about the change first, or quickly define the different levels of trauma? Because I think that's so important for people to understand. Because like you said it beautifully now,
Sure.
we all have mental health issues, and sometimes they become a problem. And in our life, even that's okay. It doesn't mean that there's something that you're crazy. It just means that life can go from an issue to a problem, but we all have issues. I love that definition. So now let's talk about the different acute trauma, chronic trauma. If you wouldn't mind briefly identifying those, and then let's end with what can we do?
Sure. I can quickly say the three areas of trauma. So the idea, remember, so trauma rises to the level, we can use the word generally, but trauma in the clinical context, right, is something, right, that rises to the level of overwhelming our coping skills and changing us as we go forward. And that something can be acute or chronic or vicarious. And acute is the clearest one to describe, right? It's something that happens, right, and then it's overwhelming and things are different. So combat trauma, which is a lot of how we see trauma, is through the lens of what happens in combat, or a car accident, the loss of a loved one, an assault, right? It's an acute trauma that acutely overwhelms us, and there are brain changes that come from that, right? But that same scenario can come from chronic trauma. So chronic denigration, right? Based upon things like race, socioeconomic status, religion, gender identity, sexuality, right? These are things that can lead a person to go through life where society is chronically or constantly telling them that they are less than. Right. And the accumulation of that over time can change the brain in the same way that acute trauma can change the brain. Right. So there's acute trauma, there's chronic trauma, and vicarious trauma that, fortunately, thank goodness, right, we are blessed with empathy, right, that we have the ability to feel other people's sadness and other people's despair. And that's a wonderful thing. But it also paves the way for vicarious trauma. And vicarious trauma is the experience of something that someone else has experienced. So people, you see people with the same changes in them that acute trauma can bring, because they're sort of glued to the constant feed of terrible things that happen in the world around us, right? And then there becomes an inability to say turn away from it, or it's just coming at us, right? And then it decreases a person's sense of security in the world, and sleep and mood start changing, and they have the same brain changes. So there's a truth to it that we see through the mechanisms of science that say, yes, that is different. And we can all get there through acute, chronic, or vicarious ways.
Excellent. Thank you so much. That's absolutely superb, helpful, and so helpful. All right. So now what can we do? And I know that's a huge thing, and I know they can go to your book, and I'd love to have you back on to dive into the second part in more depth. But for now, can you give us, because you said it's not that difficult to change, and that was a very hopeful statement that I immediately latched onto. So could you talk around that statement? Sure. There are a lot of antidotes in the book where I try and write like here's a clear thing that someone can do, and they flow through the book. I'll highlight one of them that I think is a really helpful thing that anyone can do today. Right, is we can all stop and take stock of what's going on inside of us, right? Like, what's the narrative that we're telling ourselves? What's our internal dialogue? What are we saying to ourselves, right? When we're alone, what are we thinking about, right? When we're driving from one place to another, right? What's going on in our head? What are we saying to ourselves? And to stop and take stock of what's going on inside of us, or to ask someone else, right? If someone went through something a couple months ago and they seem different, right? To stop and in a sense talk to ourselves or to someone else about, hey, what's going on inside of us? It's remarkable what the doors that can often open, right? And how we can learn, like, oh, I'm saying to myself, I mean, so many of us have a very negative self-narrative, right? As we're going through life, we're saying things to ourselves that we don't want to, I can remember before doing some therapy around this, right? I would see that,
dropped my keys, it's, you're an idiot, right? Or, or something didn't go well professionally, and, you're incompetent, right? And this idea that like a lot of us have a narrative inside of us, right? That can be a very oppressive narrative, and it can come from a lot of places, right? I mean, sometimes it can come from being, from say, early childhood experiences, right? If someone has had traumatic early childhood experiences, and they sort of carry with them an oppressor, right? Or if things have happened to us that make us feel like we're not good enough, right? The world has put those ideas into us, right? So stopping and taking a look at like what's going on inside of me, like what am I saying to myself, right? Or stopping and talking to another person, right, about what's going on inside of them if we're concerned about them, or so that something has happened with them and no one's talking about it, right? This often happens is that we are in groups, whether they're family units or they're in work settings or they're friendship settings, right? And we don't stop and talk about what we're feeling inside and what's going on inside of us. And it's remarkable to just stop and think about what's going on inside, which is often the first step clinically, right? Of sitting with someone and saying, wait, how, when you're just sitting, in a place, what do you say to yourself? And it can often open up so much about the narratives inside of us, because trauma inside of us and the changes it makes changes our narratives, right? And if you think, what are you saying to yourself now after trauma, perhaps, right? And is that different from what you were saying to yourself before trauma, right? I mean, none of us is born with a narrative inside of us that we're not worth anything, and we can't take care of ourselves, and we can't get a better job, and no one's ever going to love us, and we can't be a good parent. Like, where does that come from? Right? It comes from things that have happened along the way after we were born, right? And we can take stock of that, and we can see ourselves not just through a lens of compassion, right? But through a lens of compassion and through a hopeful lens of change, right? And sometimes it starts with changing the narrative inside of us. So I think there are a lot of antidotes and steps, and some of them are more simple than that. Relaxation strategies so we can get better sleep, right? How do we find helping resources in a world that doesn't have a lot of them, right? But I think looking at what we're saying to ourselves, it's a key starting point. It's something we often don't do unless we're kind of prompted, or we think like, it would be helpful to me to do that.
Sensate is a sophisticated infrasound resonance device that, when paired with the Sessions in Sensate companion app, works towards toning your vagus nerve, reducing stress, and improving well-being. The device emits infrasonic sound waves that are synchronized with the soundscapes in the app to provide deep relaxation in 10 to 30-minute sessions. Sensate not only works towards releasing stress and anxieties in the present moment, but it also increases your stress resilience over time, improves your heart rate variability, and helps with better quality sleep, among many other benefits. After just a few minutes, I found that I was in an enhanced state of relaxation and drifted off into a much deeper sleep right after use of the Sensate. And just for my listeners, get $25 off each Sensate with code Dr. Leaf. Just visit getsensate.com and use code Dr. Leaf. The link and details will be in the show notes. And the objective of that, I love this so much. It's such a similar approach to it. Basically what I do as well. And with the systems that I have developed and approaches in therapy. But I love how you verbalize it. And it's taking what you say a lot of in your book is taking it to the root. So once you know what you're saying about yourself, that's coming from somewhere. And that's where the trauma bit comes in. Because if it's really a lot of harsh, self-critical, whatever, that's leading to the spiral of shame, it's coming from somewhere. And I think from reading your book and listening to you, that's where you're trying to help people, is to get to that root cause of why you're saying this about yourself, and how can we look at this, the antidotes? How can we have another way of looking at that?
Right. And I think I would summarize that by saying trauma reflexively creates shame.
Thank you. I wanted to ask you about the shame, but because you talk a lot about trauma and shame. Thank you.
Yeah. Trauma creates shame in us. And if I stop and think, like, how did I feel, right, at the loss of my brother, right? It's very clear to me, even all this time later, is I felt ashamed, right? I felt ashamed that I didn't know, that I didn't see, right? And I see that over and over and over again, that there's a reflex that it creates shame in us. And then if we don't look at that and we're not aware of that, then the shame drives the narrative. right? Which is why if how many times have I sat with someone who says sexually assaulted, right? And then is telling a story of how it's their fault, right? I mean, we see it over and over again, even if it's so clear from the outside, like, oh my gosh, something terrible has happened to this person and it was not their fault. And what they need is compassion, but they're blocking themselves from compassion because the reflexive shame then wants to build a story. Right. And you see this with things that from the outside, it was so easy for other people to see that the loss of my brother wasn't my fault. I didn't see that. Right. Right. And just as someone who is assaulted doesn't automatically see that. Right. It's the shame that then comes to the surface and we create stories. And you can see how that then changes the narrative. Right. And that's part of when we're really connecting with people. That's why if we stopped and we're just throwing medicines and numbers at people with sometimes and how much money in emergency room stays and hospitals, with so much that happens if we
so
sat
invalidating.
It's so invalidating. It costs lives. It's a terrible misuse of resources. And if we sit and we talk with someone about, let's talking about the trauma and what the trauma, not that meaning everyone has to relive every detail of it. That's often not the case.
There's different ways of people handling it. Yeah.
Right, but talking about what has it changed in you, right? How do you feel afterwards, and start to look at that and like what really makes sense. I mean, how many people would say, I would never feel that way about someone else, right? But we feel that way about ourselves, right? So let's ground to that and harness some of that logic and compassion and integrate it with ourselves. And often that's how people are better, right? So often a little bit of introspection, discussion, psychotherapy, that kind of thing can make a tremendous difference. And so often we're not doing that. And then it's really the shame and the despair and the fear and all the things that the cascade that comes from the shame that are then driving us to terrible places. And it just doesn't have to be that way. I write in the book how trauma doesn't have to be in the driver's seat, right? And often that's what happens to us. And we can realize, wait, I don't want to be in the back seat. And, trauma is driving me who knows where, right? And we can take back control that way.
Oh, this is incredible. Dr. Conti, I have to ask you to come back again sometime for a part 2 so we can take this concept even deeper. Because I just, as you're saying that, I'm thinking this is something that you've probably thought about before, and I've commented a lot on this sort of thing. Health plans, insurance plans should be covering endless amounts of therapy. At this stage, most health plans, it's quite difficult to actually get them to cover any kind of psychotherapy or any kind of therapy. And when they do, it's limited to maybe 10 sessions. So that's really shooting themselves in the foot, because the bio model's taking away from the biopsychosocial spiritual model, which is more intervention. So that's one of the other things that should definitely be changing, is how the insurance plans for people work, so that that therapy is paid for. Because there's so many therapists that are out of network, and they may be brilliant therapists and people can't afford to go to them, and so that's another huge issue.
Right. The reimbursements are often so low that the therapists can't survive, and then they're out of network, or there's so many things that happen that make really no sense. I mean, I agree so enthusiastically with what you just said.
And the bio model reimburses versus the one that really works, that in the long term is going to cost a lot less money. Is not being reimbursed. So it's a complete distortion of the system. And I know that there's more and more people aware of this. And so I'd love to, as I said, do a part 2. But thank you for your wisdom, your time, your energy, the book that you've written. Where can people learn more about you, and where can they get your book? We'll put all of this in the show notes.
Sure. Thank you. The book is available at most major bookstores and outlets, on Amazon and places like that. And there's a website it's Dr. Paul Conti, just Dr. and then my name, Dr. Paul Conti. And it has links to places where people can acquire the book.
That's wonderful. And do you still practice? Are you currently still practicing?
I do. I have a clinic with there are about 20 of us, wonderful, like-minded people I'm privileged to work with. And the clinic is Pacific Premier Group. And we have a website too, pacificpremiergroup.com. And we work together, and we come through the understanding people as best we can to help them model of approach.
Wonderful. And that's in the West Coast?
We are based in Portland, Oregon, and we extend out, in many ways across the country and in other parts of the world. Yes.
And Zoom technology, now people can also get access to your group.
Yes.
Intervention. Fantastic. We'll put all those links in the show notes. Thank you so much for your time, and I'm very excited to talk to you again.
Yeah, you're very welcome. Thank you so much for having me on. I so appreciate it.
Thank you. I hope you found today's podcast interesting and helpful. If you want more tips and help with managing anxiety, depression, and mental health, be sure to visit my website at drleaf.com and to sign up for my weekly newsletter, where I also include a schedule of my speaking events and so much more. And follow me on social media. I'm on Twitter, Facebook, and Instagram. Just look for Dr. Caroline Leaf. Also, I love seeing all your posts on social media about this podcast. I love seeing what resonates with you and what you've learned. So be sure to continue posting and tagging me and letting me know what you think and how these tips worked out for you. And don't forget, leave a review and keep spreading the word about this podcast. Thank you for joining me today. I really hope you learned something new and helpful. Till then, I'm Dr. Caroline Leaf. This podcast represents the opinions of myself and my guests. The content here should not be taken as medical advice. The content here is for educational and informational purposes only. Please consult your healthcare professional for any individual medical questions you may have. While we make every effort to ensure that the information we are sharing is accurate, we welcome any comments, suggestions, or corrections of errors.